A deeply troubling new Wall Street Journal investigation found that hundreds of children who die or are left severely injured each year are in emergency rooms that are simply not equipped to care for them. Avery Guzman Mendez is one example, an epileptic 3-year-old in Burnett, Texas, who was suffering a seizure when she was brought into the ER in March of 2020. According to medical records, the doctor attempted to intubate the toddler with a breathing tube sized for a small woman before trying a series of smaller tubes and failing each time. Eventually, Avery's heart stopped. The team performed CPR 6 times, stabilizing Avery enough to fly her to a hospital in Austin, where doctors intubated her on the first attempt, but her brain was already damaged. She died 6 days later. That's one child, one family. But an AMA study from this year found 1,440 children died in similar circumstances between 2012 and 2017, each one an avoidable death. The Wall Street Journal's Melanie Evans reported on this story, and when I read it, it shocked me and shook me to my core. Tell us more about what you found when you were reporting this.
We went looking for public information about the degree to which hospital emergency departments are prepared to treat children. There is a good body of research and recommendations that date back many, many years about steps emergency departments can take to be prepared for children. So what we found was a few things. One, based on a recent national assessment, half of the nation's hospitals scored below 69.5 on a 100-point scale for being prepared. And research shows that 88 is a score that is considered well prepared, and 88 or higher is where you see some real survival benefits for children. So we found that, and then we asked, well, which hospitals are prepared? And what we found was that that information is very hard to come by. Some states have created public recognition programs, but half of states don't have them.
I also want to bring in Dr. Irwin Redlener, Columbia University senior research scholar. Wow. Half of the hospitals don't meet that 88 out of 100 standard. Who wants to bring their kid to a place that has a 69? When I was going to school, that was a D. What's happening here, Irwin? We've known this was going on. Why aren't we doing better?
Well, we've actually known through multiple studies since at least 2015, Chris, and it really is quite disturbing. And I was the director of a pediatric ICU years ago, early in my career, and obviously time is of the essence in every situation of a child who comes to an emergency room who's very sick or needs to be admitted, especially for intensive care. These solutions are actually surprisingly straightforward. One is to make sure that the hospital staff, nurses, and especially physicians are periodically upgraded about their pediatric emergency response skills. This is something that they're really great with adult patients, generally speaking, but for children, and actually it's amazing to me that a lot of adult-trained doctors and nurses are intimidated when a young child and a small child comes into the emergency room. And things like putting a breathing tube in the airway of a child is something that requires some special training, but that's doable. And part of it is just, it's just not a priority for most of the hospitals, because one of the things I think would be worthwhile doing is for parents of children, especially small children, to try to figure out where their child would need to go in the event of a severe emergency. And I can tell you how parents can actually try to do that. But the data and information, as your reporter was just saying, is not readily available. And people should go to the website of the state health department. But in most states, they're not going to get much satisfaction there. They'll tell you where are children's hospitals. But as far as the regular community hospitals have the capabilities of taking care of children, that information is hard to find, but it is fixable, Chris.
So I want to ask you really quickly, because we're almost out of time, Irwin, but I'm going to read this statistic from Melanie's great reporting, which is that how do you know the best place to take your kid in an emergency? 25 states don't check pediatric preparedness at ERs. Is there also a problem just with standards and meeting those standards? That seems to me like a baseline.
It is a baseline, and there have been plenty of studies by physicians in hospitals who run organizations that have created those statistics that Melanie reported and you just mentioned. The question is, how do they get implemented? And I think we need better incentives and better disincentives for hospitals that are not doing what they need to do to make sure children are protected. You know, ambulances, and especially in big cities, will take the child to the closest hospital, whether they have pediatric training or not. And then people who live in rural areas are really quite stuck. It's very hard to find. But the more pressure that parents and medical groups put on legislators and agencies, the more likely we are to get to some place where we can help parents and ambulance systems about knowing where to go with their sick kids. The other one quick point, Chris, is that parents should keep a list of any pre-existing medical conditions that their babies or children may have, and make sure they know what medications their kids are on, so that that information at least could be available wherever the child who's very sick ends up.
The story is revealing. Melanie Evans, thank you for reporting it. I recommend people read it. Dr. Irwin Redlener, as always, your expertise is invaluable. Thank you both.